Good evening. My name is Kyle Montgomery. I'm a registered nurse. I currently work in San Diego at Alvarado Hospital. I was able to interview Mary Kay. She is a master prepared nurse and she currently works for Sharp Mesa Vista in San Diego. She also works for the McDonald's house under Sharp in San Diego as well. Mary Kay is a master prepared nurse. She received her MSN in 1999. Mary Kay is a part of the Sharp CareCast team. What this team, there's a differential between this team and the actual IT department. She was able to explain to me that she works hand in hand with the IT department, but they do have different roles. Her role is more of the actual messages and the information that are going through during like a system check or even a contraindication or a medical scanning. So say you're barcode scanning as a nurse, the error message that pops up, for instance, if a patient is allergic to, let's say, amoxicillin. If the patient has that allergy and amoxicillin is ordered by the doctor, once the nurse or the doctor puts in that order, it should flag a red sign saying that this patient cannot have that there's a contraindication according to the allergies. Mary Kay is more of the system that works behind the scenes and gets that information out through that error message. IT may come and handle cases such as if that's not working, if that's not popping up on a specific computer in one of the facilities. Mary Kay is more along the lines of the department that handles what's actually going on. Are the systems flagging correctly? What are the percentages that are flagging correctly? What is being caught? What's being left out? So a typical day for Mary Kay, as she explained to me, is a lot of meetings. She works with a lot of feedback from not only the IT department but from nursing and physicians. Period. Whether things are being flagged, whether error messages are popping up, whether there be an error that's not supposed to happen. Say a medication isn't scanning, IT may come out and look at that. If it's a physical problem, like the barcode scanner may not be working or the battery's out, that may be a IT fix. If it's something deeper, like a system management problem, let's say that the medication is scanning and it's saying that it's something that it's not. That's when IT may take that concern and that issue to the Sharp CareCast department, where Mary Kay would be involved, and she would get into the nitty gritty, if you will, of the system and be able to not only help IT but also let the members of her team know that that is happening and the percentage of that happening and what are we going to do about it to troubleshoot and problem solve for it. A big part of Mary Kay, the interview of what I got from what she was saying, is safety. Um, Having a nursing background, Mary Kay was able to see that nurses are often multitasking. They're handling a lot of different things, and medication administration is a big one. There's many errors that go along with it as well. So having a system to back that up, unlike old school paper charting, as she mentioned, we were able to double and triple check due to the use of technology. Not to rely vastly or only on technology, but it is a second check to human error. So Mary Kay is really about safety and safety for the patient. She remembers times as when she started. She got her MSN in '99, and she said they didn't really have the technology that they do have today, and obviously things did go missed. So she is very excited about her job and excited that she was able to help protect nurses. She was very adamant about nurses being trained on the system as well, um, being that they're in the front lines and the ones normally giving the medications to the patients, being that they understand the system. So if they don't, asking IT or giving them a call. A lot of times she gets confused with IT and they'll call her office and she'll send them to IT, being that most of the issues on the front lines may be that IT can address before coming to her. But again, a typical day in Mary Kay's position, she said she meets with nurses, physicians, and different IT departments in the different facilities. She gets feedback. She continues to not only work on errors or things that are going wrong, but working on implementing new things into the system that may help even more. Some things she indicated was color coding, whether that be flagging red or flagging blue, for instance. She was discussing with us if a medication is newly prescribed and the patient has not been given it yet on the MAR, the medical record, electronic medical record, it may come in a different color. Instead of white, it may be baby blue. So that the nurse knows that this patient has never received this med. So for the first time ever, I'm giving this patient this med. So may need to check in. It may have a note on it that Mary Kay was saying that's kind of her job. The message behind it is kind of her job. The note may say, take vital signs. If it's a blood pressure med, take blood pressure 15 minutes after this medication is given. Those type of messages are what Mary Kay is basically responsible for. So it's a little bit deeper, I guess you would say, than a typical IT position. Is what she kind of was getting through to us as we interviewed her. Advice she gave for a nurse looking to get into informatics was basically just, she said, now that we're kind of out of paper charting, most hospitals, if you're looking for it, have a system or have a computer system, so someone is working in either an IT department or a department like hers. So just ask around, get involved, volunteer, ask to possibly shadow someone, or really just kind of open your mouth and figure out what you can do and what that IT department does if that's your interest. She was pretty adamant about not really knowing about the department when she started. She had no idea that she'd become an informatics nurse, and look where she is now. So she was able to kind of pass that down. And she said she really just she came upon someone that was doing it throughout her nursing journey. She thought it was pretty interesting. She saw that how much technology has advanced between the time she started and now, and she wanted to get behind it. So she did some volunteering herself. So she really recommended volunteering or just asking questions to those that know more about that part of the department than you do. An impact that this had on my nursing path as a master prepared nurse was really what Mary Kay was saying, and the ability to network. It was kind of a struggle even finding a nurse that worked IT. The nurses at my job that worked IT, the people that work IT at my job aren't prepared nurses. They don't have their BSN. Most of them, they have backgrounds of a different specialty. So in order to find a nurse, I had to do some research and do some networking myself, which was good. It was good. I was able to, before finding Mary Kay, I was able to see even other positions that I didn't really know about, and they all have nursing as has vast possibilities, and it's under a huge umbrella of technology, outpatient, home health. There's just so many opportunities under nursing that I really wasn't aware of, and in order to reach out and network and find this nurse just really helped with my networking skills as well. I had to ask questions. I had to talk to people I've never talked to, even at my own job, and was able to build connections and relationships with those people, even by just asking a few questions. So I think not only that, but just opening my eyes to the different possibilities and never knowing, like Mary Kay said, when she started out in her nursing journey, she didn't know that she would end up being an informatics nurse. So just not keeping the blinders on and just being so stuck in my ways to the position and the title that I currently hold, but just being open to everything and never knowing what's going to kind of come up or what I will enjoy even more. So just kind of being more like Mary Kay in the fact that she's a seasoned nurse that was, looking out and looking for new opportunities in the field, and you're still a nurse, but you're just handling different positions. She seemed to really enjoy her job, and I really appreciate her time and taking it out to help answer my questions and open my eyes to informatics nursing.